Good morning everybody. Thanks for joining me for another video. This is going to be a video on another aspect of my health. I would like you to take a minute and think about the following scenario. How would it affect your life if you have a life-threatening disease which you need to take medication for every day, and your body, your immune system cannot handle the medication? The medication is actually making you feel more sick than what the illness does. And that is exactly the situation that I find myself in. And it is a very stressful situation, and because I've got a heart problem which I need to take certain medications for. I've got familial very high cholesterol. My normal cholesterol, if I do not take a statin, is 14-15. So I looked on Google how you can convert it to the American, how they measure cholesterol. And they said that you must multiply that number by 38 or 39. Then that gives me a cholesterol of 585. Right, here's the tablet. I'm going to take it now. I wasn't going to take it. I decided not to take the statin this morning because when I woke up I felt terrible. It felt like I couldn't walk. I couldn't put my one leg in front of the other one. I've already quartered the statin. I took only a quarter yesterday morning. I was standing with the statin in my hand and I decided to put it back in the container. So this can't be the statin. What's going on now here? I just said to MacD I'm going to go to the doctor. So I'm going to take another one of these, which doesn't make me feel good, but it will feel better than the sensation that I'm having now. I think I'm in for some trouble here. So I have developed something which makes me super sensitive to medications. And when I was in the hospital for the colonoscopy and scope procedure, the nurse asked me whether I have tested myself for porphyria before. And she said because the symptom sounds very much like somebody that suffers from porphyria. So when my medical aid kicks in again in January, I have asked the doctor that we then test for porphyria. There is no treatment for porphyria, but there is a huge list of drug ingredients that you must stay away from, which can cause problems in your system. So we are going to look at that in the beginning of next year. What indicates that you suffer from hypersensitivity syndrome? There are some clinical manifestations which then involves the organ systems like the skin, respiratory tract, cardiovascular reactions, heart palpitations like I'm having, gastrointestinal reactions, what I had for about a year now. I don't know why the heart specialist decided that my cholesterol of 2.4 wasn't good enough and that he wanted a 1.7 count, and that he made my cholesterol medication stronger and took the original way and gave me a generic, and it stuffed everything up. So much so that I had to stop taking all medication. I could not eat properly. My clothes aren't actually fitting me. I have problems getting dressed in the morning. All my clothes are getting too big because my stomach problem hasn't been resolved yet. And obviously you get like skin manifestations and mucosal reactions, which will be your my my sinuses start to become more active, get a runny nose or a blocked up nose, um, skin rashes, and I, for instance, had a sore tongue on the left side, very sore tongue, for about two days, and I've been rinsing my mouth with some mouthwash. And last night it flared up on the right hand side. It's still there. It's better this morning, but it's still there. Um, I didn't make the connection. I'm now making the connection to the statin because it's actually listed on the Rosvator side effect pamphlet that that can actually be a side effect. Would you now think that that would be a side effect that you would suffer from a cholesterol lowering medication? Fever, fatigue. I can normally feel very quickly when a drug is not working with me. Years ago, when I was still treated for depression, the doctor prescribed an antidepressant for me. The appointment was just before I was going to have lunch with my parents. And I thought to myself, well, I filled the prescription at the chemist. I've got the medication. I'm going to eat now. You must drink the the pills with food. I will soon take my first dose of my medication then, which I did. And then my mom wanted to go to the grocery store, Spar. We've got a Spar in South Africa, and which was in the same complex as the restaurant that we had lunch in. And we were going to buy groceries, and in the grocery store I passed out. So they had to bring a wheelchair, had to wheel me to the car. And that's actually how I met the last boyfriend that I had, because his son, Marius Jr., came over to actually help my parents to get me out of the car. And he carried the shopping into the house for me. And then he sat a little bit with me. My parents went home, but he stayed a little bit with me, just to sort of make sure that everything was okay. That was a severe reaction to a medication which normal people don't have, and that often happened to me. But I've got this vasovagal problem, and I see that on the Cardicor that syncope is one of the side effects of the Cardicor. That is the beta blocker that regulates the heartbeat. Then they also make the association between the Epstein-Barr virus and drug hypersensitivity reactions. Now, there's also a huge link between the Epstein-Barr virus and ME, chronic fatigue syndrome, myalgia encephalitis, chronic fatigue syndrome, which is MECFS for short. And here they are actually making a correlation between drug hypersensitivity syndrome and Epstein-Barr virus. Now, Epstein-Barr virus, or EBV, more commonly known as glandular fever or infectious mononucleosis. Following the acute symptomatic phase, Epstein-Barr virus persists in the memory B cells in the tonsils. Now, my tonsils have been removed, and peripheral circulation of the infected host in a latent non-lethal carrier state throughout life. So once you had it, it doesn't really leave your body, it just goes into a remittance, and then it sits there and waits for your next infection to reactivate. Virus can be shed intermittently and infection may reactivate. DermNet says that EBV can cause drug-included hypersensitivity syndrome. Drug hypersensitivity reactions, which also the acronym is DHR, includes allergic, exaggerated, pharmacological, and pseudo-allergic reactions to medications that result from an enhanced immunological or inflammatory response. Pseudo-allergic reactions are those reactions that produce the same clinical symptoms with anaphylaxis but are not IgE mediated. Adverse drug reactions. An adverse drug reaction is a general term referring to any untoward reaction to a medication. Adverse drug reactions may be broadly divided into two types, type A and type B. Type A reactions. Type A reactions make up 85 to 90% of all adverse drug reactions. These can affect any individual given sufficient dose and exposure and are predictable from the known pharmacologic properties of a drug. Examples of type A reactions include diarrhea in response to antibiotics, gastritis in association with long-term use of non-steroidal anti-inflammatory drugs. Then type B reactions. Type B reactions represent hypersensitivity reactions. They make up 10 to 15% of adverse drug reactions, occur in a susceptible subgroup of patients, and have signs and symptoms that are different from the pharmacologic actions of the drug. The great majority of hypersensitivity reactions are mediated by immunologic and or inflammatory mechanism. In addition, there are reactions referred to as idiosyncratic drug reactions and exaggerated sensitivity reactions, which present with symptoms that do not involve the immune system or inflammatory cells. Okay, I will have to wear my glasses like this because if I look up, then I get that. Okay. So these are the side effects of the Cardicor that I'm drinking for the heart palpitations. That is the beta blocker. And I'm reading that because that you can see what the side effects are and what the culmination of all the tablet side effects must be. I don't think that my body actually knows quite what's going on. Okay, for the Cardicor 2.5 milligram film coated tablet, a rare side effect is increased triglycerides, increased liver enzymes. Now that works completely counter to the statin, the Rosvator, because the Rosvator is trying to lower the triglycerides and the Cardicor is increasing the triglycerides. I don't know if that is why maybe my cholesterol is through the roof. Nervous system disorders. Common is dizziness and headache. Rare is syncope. I'm struggling with vasovagal syncope. That's one of my big problems. I did mention that in a previous video that the vasovagal nerve runs here from the back of your neck, basically through your whole body, your heart, your stomach. The vasovagal is the biggest nerve in the body. Ear disorders is hearing disorders. This fullness in my ear, which is coming on from the Meniere syndrome, and also the esophageal tube that keeps on blocking, the vertigo, the respiratory thoracic disorders. Uncommon is bronchospasm in patients with bronchial asthma, and rare is allergic rhinitis. Gastrointestinal disorders, this is where my whole stomach and intestinal problems started. Common, very common, gastrointestinal complaints such as nausea, vomiting, diarrhea, and constipation. Skin and subcutaneous tissue disorder, rare, hypersensitivity reactions like pruritus, flush, rash, and angioedema, very rare. is alopecia, that's where your hair falls out. And also, beta blockers may provoke or worsen psoriasis or induce a psoriasis like rash. You know what's happening to me here actually? Exactly what happened before I left all the medication, which made me rush to the ER all the time. Because it feels like I'm having a heart attack. And then I would get up in the middle of the night and I would rush myself to the ER, and then they would find nothing wrong. That's exactly what's happening. I've got the tightening of the throat. I feel very heavy and tight on my chest. I've got breathing problems. I am not feeling good. I wonder if I must drink that tablet and if I must just sit it out that the stuff gets out of my system. It feels like it's tightening up here in my throat. Musculoskeletal and connective tissue disorders, uncommon, muscular weakness and cramps. I did a small section of the pebbles yesterday, and the whole time I was complaining to McDavid that I can't sit. I am in agony. My body is sore. I was trying to sift the worms out yesterday. I couldn't sift the worms out. My arm I didn't have enough strength to shake the sieve. Vascular disorders, common feeling of coldness or numbness in the extremities, hypotension, common asthenia and fatigue. Psychiatric disorders, and I'm sure that it's playing on my mind, uncommon sleep disorder and depression, rare nightmares and hallucinations. So that is that little white tablet which I started taking to control the heart palpitations, because I was starting to have heart palpitations. I don't know what to do. Then the Rosvator statin that I'm drinking has got the following side effects. Severe muscle problem warning. The medication can cause severe muscle problems. These include myopathy, with symptoms such as muscle pain, tenderness, or weakness. Myopathy can lead to rhabdomyolysis. With this condition, muscle breaks down and can cause kidney damage and even death. If you notice unusual pain or weakness in your muscles, especially if you feel more tired than usual or have a fever, call your doctor right away. Your doctor may decide to stop your treatment with this medication. Call your doctor right away if muscle problems lasts after your doctor has told you to stop taking this drug. Liver problem warning. This drug can increase levels of your liver enzymes. Increased liver enzymes can be a sign of liver damage. Your doctor might check these levels to make sure that this drug is not harming your liver. Rosvator is used to reduce your LDL, that's your bad cholesterol levels, and increase your HDL, which is your good cholesterol levels. It also reduces your triglyceride levels, that's the fats in your blood. Improving your cholesterol levels helps prevent blockages from forming in your arteries. These blockages can cause serious problems, including heart attack or stroke. I'm basically a heart attack walking around waiting to happen, and there's nothing I can do about it. I cannot handle the medication. I cannot drink medication to prevent myself from having a heart attack and a stroke, and then I can't do anything. I become non-functional. I'm lying in my bed all the time. It feels like I can't use my arms. It feels like my legs don't want to work. I can't put my one leg in front of the other leg. I am in such a predicament. You've got just no idea. The side effects are headache, which I have been getting. I've never, ever suffered from headaches. The last thing I could complain about was having a headache. Now I have a headache every night. Pain in the abdomen, stomach area, muscle pain, nausea, weakness. I've got all of that. If these effects are mild, they may go away within a few days or a couple of weeks. I think I've now been trying this medication now for 10 days. If they more severe and don't go away, talk with your doctor or your pharmacist. Serious side effects and their symptoms can include the following: severe muscle problems. Symptoms can include unexplained or unusual muscle pain, weakness, fever. Liver problems. Symptoms can include unexplained or unusual weakness, decrease in appetite, pain in the abdomen, dark-colored urine or yellowing of the skin or the whites of the eyes. Warnings. Allergy warnings. This drug can cause a severe allergic reaction. Symptoms can include rash, hives, swelling of your face, mouth and tongue, trouble breathing. I'm having trouble breathing and my tongue was sore on the left side. So I had to start rinsing my mouth out. I actually took a photograph of my tongue now because last night it was on the right side. It's a little bit better this morning. Then the people want to know, why am I not interested in a relationship? I said this morning, I cannot even think of relationships or whatever goes with relationships if I can't even function normally, if I can't even get myself through a normal day, if I can't do normal things. I've got a whole mountain of ironing lying in that other room. I must iron, but at this point in time, my muscles aren't strong enough. I won't be able to stand. I won't be able to use the iron. It feels like I'm waiting to die, and as if it's going to be very soon. And the worst thing is that nobody takes you seriously. Fortunately, my GP does, but what can he do? He can just experiment. There's nothing he can do, you know. I just realized something. I've been touching my back of my neck a lot. And that one tablet has got syncope as a side effect. That is maybe why my back of my neck has been bothering me. I have become aware that in a lot of my videos I'm in my neck all the time. So maybe that's that little tablet that is causing that. I'm sorry that I'm getting so emotional. I also think it's the tablets that messing with my head. So on that dark and depressing note, I'm going to end this video. And I think I must do my next video on hoarding again so that I can laugh at myself. And I hope to see you in the next video. And as always, keep well and look after yourselves. Hopefully till the next time. Bye.